with Tom Quigley at ClaimLinx. This is a short one because we had such a long one on Tuesday, or vice versa on podcast, because we knock out 2 a week, Tom. But this one today is the latest news with ClaimLinx. It's 2026. What's new? We've already almost finished January.
Oh, we have several good things going on. Our employers have access to Employee Navigator, which is a software program they can use to administer everything from payroll to their benefits. Great stuff. We also have more stats. So the stats is out of every 100 people, 8 hit a $5,000 deductible. Think that through. That means 92 do not. 20 out of every 100 hit a 500 deductible, which means 80 do not. So people are just throwing away thousands thinking that because of the HIPAA laws, no one, knows anything. But what we're finding is more and more of our clients are starting to realize that what we said is actually true. And they have, most of them, for years, but some of the newer ones are fascinated. So we've done some stats. So we have all kinds of stats. We got a good claims portal that people can look into to see where their claims are. The young ladies, my service team, are really helping people out and getting drug manufacturer rebates and all those good things. So it's a exciting time, saving people money. We're saving them, millions yearly, collectively, and we're hoping 2026 is a booming year.
No, I think it's going to be a big year. And I think that your solution, it's just people are either deciding, I'm going to pay for benefits, or am I going to be able to take a vacation as a business owner, some business owners, or certain costs to see the extreme cost of healthcare. So working with you, they're going to save a lot of money, and they're also going to provide better benefits for their employees. And you're just seeing that the group increases are outrageous. So they stuck the people at healthcare.gov by eliminating those enhanced subsidies. Mm-hmm. And you saw they passed it on not just to them, but also to group health, haven't they?
It's really funny if you notice the newest government shutdown, they don't even talk about subsidies.
I didn't know that. Oh, no.
They're not even talking about subsidies enhancing the enhancements that's gone. They're on to other things like defunding ICE and all this other garbage. So now you don't even hear about the enhanced subsidies that are gone bye-bye. So
it's just back to spending a lot of money again.
Or listen to people that actually know what they're doing.
Exactly. That's why Tom needs to be in the White House in some sort of way. But the thing is, let's talk about this further. It's terrible because now you got to kind of retool yourself. It's the biggest tax increase. Wouldn't you agree? Getting rid of the enhanced subsidies, but also the group health increase. And a lot of companies then just put it on their employees, right? And say
they're just dropping it. The smaller ones saying we can't afford it. Good luck. And the whole idea they had in the first place was retain and attract employees. So it's like, what are you doing?
Oh man, it doesn't sound good. I think, and this is why you're seeing yourself more busy already this year, is because it's just really a bad outlook for healthcare.
It's something that you've got to change. You can't do what you were doing. And that's the issue. The insurance agents it's not a pleasant time for them.
It isn't. And you run into this situation. What is it better just to roll the dice, Tom? If you are not going to the doctor, that's the other thing, is look at exactly how much are you truly paying. That's unbelievable numbers to know most people aren't even close to that deductible every year.
No, by the way, that's under 65.
Okay.
Well, under 65.
Yeah, but you're not really selling to under 65 anyways, because they're going to go to...
Everyone's under 65 over 65, they have Medicare. Yeah, but so under 65, those are the stats. 8 out of 100 people, 8%. And then the thing is funny is out of that 8%, half of them can get grants and drug rebates that will pay for their whole deductible, so they're not actually coming out of pocket. So
and all their income, right? In certain hospitals, if you have only a certain income, you're not going to even have to pay the hospital bill.
4 out of 100 Americans have to actually pay somebody $5,000 or more. if they have that deductible. Yeah. I
And
think
see, that number has to be told to people.
yeah,
Really, it has to. That is really impressive. I know we just did news this week, but after we go over part 2, where you're going to teach us how to buy it now, right? You got us approved to buy the health insurance. Next week, you're going to show us how we buy it. Then I want to go back and show these numbers even more. That's just crazy. That needs to be discussed in Washington, D.C. It has to say, okay, why is that? And it's because most Americans are not that sick. They're sick in certain ways. They're not taking care of themselves. So by the time they turn 65, they're going to have horrible health. But before that, they really aren't utilizing our healthcare system at all.
the whole system it's based off fear right now. They scare you into making bad decisions. And I'm all about love. So I don't do that.
Exactly. One love.
More love, baby.
Yeah. All right. So ClaimLinx.com. Appreciate it, Tom. Thanks for the time today. We'll talk soon.
Take care.
That was the special simulcast of the Neil Haley Show on the Cutting Edge Benefits Podcast, guys.